Hello, my name is Sonali Barman and I'm a registered nurse. In this video, I will be addressing women's reproductive rights. Specifically, I'll be speaking about President Donald Trump's recent rollback on the mandate under the Affordable Care Act, which would restrict women's access to birth control based on religious or moral grounds. As a woman and a healthcare professional, I feel strongly about women's access to contraceptives for family planning as well as for healthcare management. Contraception is crucial for helping women avoid unintended pregnancies and also has a myriad of health, social, and economic benefits. In 2012, the Obama administration followed a recommendation by the Institute of Medicine to ensure that birth control will be covered as preventative service with no cost sharing with the insurance companies. This contraceptive mandate allowed many women to easily access birth control to avoid pregnancies, delay pregnancies, and to exercise their reproductive rights. Numerous studies have shown that women's access to birth control reduces both pregnancy rates and abortion rates. The CDC report shows that teen pregnancy rates have been declining steadily over the last decade, and this would most likely keep declining if the ACA contraceptive mandate remains in place. Also, as seen on this chart by the Guttmacher Institute, the abortion rates have also been declining rapidly since the ACA mandate of 2012. Numerous other studies show that when people have cost-free access to birth control methods of their choice, they are less likely to have unintended pregnancy and therefore less likely to need an abortion. So the problem is that in October 6, 2017, the Trump administration released two new rules that allow any employer with religious or moral objections to refuse to comply with the Affordable Care Act requirement that women receive insurance coverage of birth control without additional cost. The Trump administration issued two separate rules. One exempts virtually any employer from providing birth control coverage because of religious objections. This includes nonprofit organizations, closely held and publicly traded for-profit companies, and any other non-governmental employer. It also includes institutions of higher education. The second rule grants an exemption for employers other than publicly traded for-profit employers if they object based on undefined moral reasons. In other words, the Trump administration has granted an exemption from providing birth control coverage to almost the entire American workforce. It is impossible to predict how many employers will take advantage of these new exemptions. There is no requirement process for employers to certify that their religious or moral beliefs are legitimate, and there is no special notice required to employees. At this time, 55 million women have access to birth control without co-payments because of the contraceptive coverage mandate, according to a study commissioned by the Obama administration. Under the new regulations, hundreds of thousands of women could lose those benefits. So you may be wondering why this is a problem. There are three main points to consider when looking at this issue. First, the rollback on the contraceptive mandate is discriminatory towards women. Second, it impacts women's health negatively. And thirdly, it forces women to have a higher cost for basic preventative health care. The sex discrimination is evident when health insurance company plans can cover most prescription drugs, but not birth control pills, illegally discriminating against women. Fatima Gause-Graves, the president and CEO of the National Women's Law Center, stated that the Trump administration shows callous disregard for women's rights, health, and autonomy, and by taking away women's access to no-cost birth control coverage, the rules give employers a license to discriminate against women. Secondly, there is the problem when basic health care is not provided to women. Under the Affordable Care Act, the federal guarantee specifically required coverage for 18 methods of contraception used by women without co-payments or deductibles. These contraceptions were used for not only preventing and delaying pregnancies, but also to address hormonal disturbances for women. Many people seem to think that birth control is affordable, but high costs are one of the primary barriers to contraceptive access. Although 3/4 of American women of childbearing age have private insurance, they still have to pay a significant portion of contraceptive costs on their own. This table by the Center of American Progress shows the estimated out-of-pocket cost for contraceptives that includes the doctor visits. And according to the National Women's Law Center, cost of birth control made up to 30 to 44% of women's total out-of-pocket healthcare costs. So, what does this mean? Some women who cannot afford the cost will stop using birth control, while others will have to choose between birth control and other medical care or necessities. So, you may be wondering, what is the current status of the rollback on the contraceptive mandate? Well, soon after the Trump administration enacted the rollback, California's Attorney General Becerra filed a lawsuit claiming that it was unlawfully discriminating against women. In December 2017, the federal courts in both Pennsylvania and California have granted injunctions that block the Trump administration's flawed rules denying contraceptive coverage. Then you may be wondering if you can help in this process. Well, the good news is that you can. You can take action against the rollback by first using your voice. You can talk to your employers about this issue or call the Capitol switchboard and talk to the politicians, or also post on social media with hashtag #HandsOffMyBC, which is hands off my birth control. You can join and donate to these organizations below, which are Center for Reproductive Rights, the American Civil Liberties Union, and the National Women's Law Center. Also, you can share the information that I have provided in this video with others. With our combined efforts, we can be strong advocates for women's reproductive health care rights.